Parenting podcasts can be a bit earnest. Parenting Out Loud is not that podcast.
This person who I may not agree with politically is trying to talk about integrating children, not just into his professional life, but into public life.
I have referred to myself as one and done. That article did make me rethink the term.
It took about 11 seconds for this to go viral.
Oh God, is this the ejaculate one? That is deranged and I love it.
Parenting changes the way you see everything. Parenting Out Loud takes the big conversations of the moment and puts them through that filter.
Because if parents are thinking about it, we're talking about it.
Parenting Out Loud. Listen weekly wherever you get your podcasts.
You're listening to a Mamma Mia podcast.
The idea of going to your doctor and having to show your butt, it's intimidating.
I just want to reassure everyone, I see about 5 butts a day and I have no recollection. As soon as you walk out the room,
You've forgotten about my butt?
I'm sorry. Your butt is forgotten. It is not that memorable.
Okay. Hello there. Welcome to Well Australian Women. This is your full body health check. I'm Claire Murphy.
And I'm Dr. Mariam.
And today we are answering a bunch of your questions about some of the cancers that we have been talking about in recent weeks. I will let you know that I, back in the day, had an abnormal pap smear, which they found precancerous cervical cancer cells. I had a biopsy done first, and then I went and had laser surgery to have the surface of my cervix lasered to remove those precancerous cells. And then when I went back for my follow-up, my gynecologist back then, who looked quite a bit like Father Christmas, he did my exam and he goes, "Darling, your cervix looks fabulous. You should show everyone at a party."
Can you imagine? I'll give you a speculum.
It was a great compliment. I tell people about it all the time. But I feel like pretty much all of us have had a friend or a family member or someone in our orbit who's been impacted by breast cancer, or ovarian, bowel, or cervical, endometrial, we call it. And it can be a really rough journey. So for those of us who get left behind by those who've been through that too, that can also be really tough. So if you are dealing with something like that right now, our hearts go out to you and we hope you have all the support that you need around you. And we don't just mean medical teams, we mean mental health support and friends and family too, who
It's really important.
hopefully have your back as well. But something I wanted to note today is sometimes a diagnosis can have ripple effects across the world. Remember when Kylie Minogue was diagnosed with breast cancer? The impact of that was incredible, with women going to get things checked out that they might not have done so otherwise. Now we're seeing Olivia Munn, the actress who's gone through breast cancer, and her mum has been diagnosed with it too, and she's been talking quite a bit about her journey. They have real impacts on global populations of women, which is why it's so super important that we talk about them, because if we do all of this behind closed doors, all it does is make us a little bit more wary about getting ourselves checked. So it's really important that you do talk about these things. And Olivia Munn, the test that she's been talking quite a bit about online, I talked to Dr. Yo about as well. And so if you want to go back and have a listen to that in our episode on breast cancer. And I want to say too, there are some times when celebrities get diagnosed with a cancer that is not as common as the ones we've just talked about, and can sometimes be in places that people do feel really shameful about, like when Farrah Fawcett came out and said that she was dealing with anal cancer. That is life-changing for people who experience that, or who might experience that down the track, because they're like, well, if she can talk about it, I can talk about it. So we here want to talk about all of these things so that you don't feel like it is a taboo thing.
These conversations are important, yeah.
So, Mariam, have you had a personal experience with cancer?
I'm grateful to say I haven't.
Oh, so lucky.
For now, anyway. But professionally, I've walked alongside many women through every step of their journey, whether they've faced breast, ovarian, endometrial, bowel cancer. And those experiences have taught me just how complex these diseases can be and how critical it is to act early and lean into support. And yes, when these public figures choose to be open about their cancer struggles, it can truly change the game. When Angelina Jolie shared she carried the BRCA1 gene mutation and chose preventative surgery, referrals for genetic testing tripled in Australia.
Yeah, right.
So it's a powerful ripple effect. Having these conversations is so important.
Yep. So if you are going through this right now and you feel like you're doing it behind closed doors, reach out to people, have conversations. It's super important to have a network of humans around you because there is a lot of evidence that shows that having positive people around you helps you get through treatments easier. It helps you face these things when you're not doing it by yourself. So you're not alone. We do have quite a few questions to get through today, but give us a sec. We'll be back and we'll dive right in.
Let's do it.
So we are kicking off the questions today about uterine, cervical and ovarian cancers. So Mariam, you are up first today. The first question from our Well community is this one. I tested positive for HPV when I was 25 and I'm really worried about developing cervical cancer. My GP told me that I would have to have a follow-up in 12 months to see if the HPV has cleared. Should I be worried, and what happens if this has not cleared? Will I develop cancer?
I hear you, and getting that positive HPV result at 25 can feel overwhelming, but it's important to remember you're not alone and there's a clear path forward. It's very common. And it's completely normal for your GP to recommend that follow-up at 12 months. It's standard practice to monitor how your body responds to the infection, remembering you've tested positive for the virus.
Doesn't mean you have cancer.
Doesn't mean you have cancer. So most HPV infections, especially the low-risk types, which is what you have if you've been asked to repeat in 12 months, are cleared by the immune system within 1 to 2 years without causing any issues. And if it does persist beyond that time, your GP may refer you for further testing, such as a colposcopy, to examine your cervix for any abnormal cell changes. However, even if the infection doesn't clear, doesn't automatically mean that you're going to develop cervical cancer. We know that the progression from HPV infection to cervical cancer typically occurs over many years, and that's if your body hasn't cleared it in the first place. It's also worth noting that certain factors can influence the risk of persistent HPV infections, including smoking and a weakened immune system. So while it's natural to feel concerned, try to focus on the steps you're taking now, regular screenings, making sure that you're following up at the appropriate scheduled time and staying on top of your health. And remember, you're not alone in this journey. If you're feeling really stressed or worried about the result, book in with your GP, have that chat for reassurance.
Excellent. All right. Next question. I'm in a same-sex partnership and have never had sex with a man. There is, in the LGBTQIA plus community, a name for people. It's like gold standard lesbian or something along those lines who've never had sex with a man. I'm sure that might be wrong, but I'll double check. She writes, I've always thought because of this, I wasn't at risk of getting HPV. Is that right? Should I still be getting tested?
Okay, great question. Let's unpack this. First off, it's a misconception that HPV only affects those who have sex with men. HPV can be transmitted through any genital skin-to-skin contact, regardless of gender or sexual orientation. So this means that women who have sex with women are still at risk of contracting HPV and consequently developing cervical cancer. In fact, studies have shown that lesbian, bisexual and queer women are just as likely as heterosexual females to develop cervical cancer. However, they are often less likely to undergo cervical cancer screenings, which can lead to a later stage diagnosis, which is why self-collection for these populations is a great option if they choose to do that. The National Cervical Screening Program here in Australia recommends that all individuals with a cervix aged 25 to 74 have regular cervical screenings every 5 years.
Just so you know, I just Googled what the name for a lesbian who's never slept with a man. It is Gold Star.
It is Gold
lesbian,
Star.
So sorry if I misled you with Gold Standard. So from Gold Star lesbian to the other end of the spectrum, this person has written in, I've had sex with a few different men. I know that HPV is sexually transmitted and that it can lead to cervical cancer, but I did get the vaccine when I was at school. Do I still need to be worried about HPV if I've had the vaccine?
Let's break this down. So first off, it's great that you've received the HPV vaccine during school. It's an important proactive step in protecting yourself against certain strands that we see that can lead to 90% of cervical cancers. But it's important to understand it doesn't cover all those strains that can cause.
Because there's quite a few, right?
There's quite a few. So even if you've been vaccinated, it's still crucial to participate in regular cervical screening. All individuals with a cervix need to be screened from 25 to 74 at 5-year intervals, assuming they have negative test results. And the reason for this is that the vaccine doesn't eliminate the risk entirely. There are other high-risk HPV types that can still cause cervical abnormalities. So regular screening will help detect any changes early, allowing for that appropriate timely intervention and reducing the risk of cervical cancer.
Okay. And when I said male partners, it actually doesn't matter, right?
It doesn't
So
matter.
It can be
It
whoever
doesn't
your
matter.
partner
Yeah.
is. Yep. So the next few questions, and we have had so many great ones from you guys through the waiting room and through DMs and through our email. So thank you so much for sending them in. But these next ones are going to be answered by Professor Claire Scott. She's a medical oncologist.
I would have a massive intellectual crush on her.
Oh my God, she's so accomplished,
Yeah.
right? We asked her about whether having other issues might increase our risk of cancer.
So, Claire, our first question for you from our Well community is this one. This person says, I have endometriosis and PCOS, and I'm really worried those increase my cancer risk. Am I more likely to get something like endometrial or ovarian cancer?
So having both polycystic ovarian syndrome and endometriosis can raise your risks of ovarian and endometrial cancer by a slight amount, but the majority of women with those syndromes will not get either of those cancer types. So if we just take them one by one, having polycystic ovaries makes you exposed to different types of hormones, so more estrogen than you would otherwise be, and that increases the risk of endometrial cancer, not ovarian cancer. So the risk there is about 2 to 3 times higher. Now, sometimes women with PCOS are overweight and have obesity, and there is evidence that just reducing weight by even 5 to 10% could improve the symptoms of PCOS and potentially reduce the risk of cancer. With endometriosis, it sounds like it should be an increased risk of uterine or endometrial cancer, but in fact there is a slight increase in ovarian cancer risk. And again, that's probably just 1.5 to 2 times higher than the general population. And those risks are already low, so doubling the risks means that they're still fairly low. And the issue there is that it's the types of cancers that are not the sort of ovarian cancer that we talk about or that you often hear about. So its name is high-grade serous ovarian cancer, and that risk is not increased by endometriosis. It's 2 other types, clear cell ovarian cancer and endometrioid ovarian cancer. So the majority of clear cell and endometrioid ovarian cancers are not the aggressive type. It's very much more rare for either of those two to act in an aggressive fashion. And in fact, for PCOS as well, those endometrial cancers that occur, they are probably also not the aggressive type. So overall, I'd really say stay fit, stay well, exercise, move around, try and control your weight. And those cancer risks are not something that you should be spending a lot of time worrying about.
All right, our next question is this one. I heard about a study that linked hair straightening treatments that have formaldehyde in them to uterine cancer. What do we know about exposure to chemicals and things like cancer in our uterus?
You're right. Many hair straightening products do contain formaldehyde or chemicals that release formaldehyde. And formaldehyde is classified as human carcinogen. Of course, these chemicals are at low level, but it is technically possible that you could get some absorption through the scalp. And particularly if there's scalp irritation for some reason, like say you had some inflammatory disease of the scalp or got a burn from any of the hair care products. Certainly the risk is likely to be higher if there's frequent use, so that would be more than 4 times a year. And some ethnicities have perhaps an increased risk if they use the products much more frequently than that, so potentially Black women in the US. So I think more research is obviously needed, but limiting your exposure to those products might be a good idea, and particularly if you have any other risk factors for cancer.
Okay, our last question for you, Professor Scott, is this one. I'm post-menopausal and haven't had a period for 2 years, but recently I got a little bit of spotting. Should I be worried about it being cancer?
So any bleeding that is not normal for you is a concern and should be followed up with your GP. So sometimes people know how often they have their periods and then they have a bleed when they're not meant to have one. If that has occurred a couple of times, you should see your doctor about that. If you're after the menopause and you've had some time where you haven't had a period at all, for example, in that early stage when you aren't quite sure if you finished or not, it's always reasonable to be checked out as well, whilst knowing that most of the time, if you're really early in that time period, it's probably just the organs getting to the end of what has been a lifelong habit. If you are well into the menopause, then you should absolutely be checked out straight away. So the reason for this is 90% of endometrial cancer cases present with bleeding, and that means that that's a useful sign and symptom to follow up to have early diagnosis, hopefully. So you definitely don't want to ignore vaginal bleeding, but do expect when you're going in that you're overwhelmingly likely to hear good news. But still, it should always be brought to medical attention.
Now back to you, Dr. Mariam. What's the difference between a pap smear and a cervical screening? Someone also mentioned that I could do the swab at home. Are these tests the same thing? Which is better at detecting HPV, and how often do I need to get them done?
All right, lots of questions there.
There is quite a few questions in that one question, yes.
Let's get to it. Okay, so in 2017, we bid farewell to the 2-yearly pap smears and
praise be to that. If you have not had a pap smear, you are lucky.
And we warmly welcome the 5-yearly cervical screening test, commonly called the HPV test. So what's the difference? So the traditional pap smear looked for abnormal cervical cells. So damage has already occurred. The cervical screening test is smarter. It is looking for the high-risk HPV virus that leads to almost all cervical cancers, catching the problem before any cell changes occur. And that early detection is what's making all the difference. You're detecting the root cause and not just the aftermath. Because the HPV test is more sensitive and reliable, you only need to do it every 5 years, not every 2, which is warmly welcomed. And now on to the question I hear a lot, can I do the swab at home? So if you are aged 25 to 74 and due for screening or overdue, you can choose to do it yourself or have a health provider collect it for you. Self-collection must be arranged through a GP or a healthcare provider. Both options are essentially checking for that HPV virus, either from your vagina or from the cervix. And the amazing part is evidence shows that the self-collected samples are just as good as picking up HPV as the clinician-collected ones.
So don't be worried because I know some of my friends be like, what if I don't do it right? Or what if I don't get up high enough?
And it's really good to go in. I usually get my patients to do it on site because I can explain to them how to collect it, and if they've got any worries,
they can just pop off to the bathroom and do it, or you can leave the room.
Or I can close the curtain and say, if you want me to stay on the other side and just talk you through it.
Right.
Well, I just offer all those options to them and whatever makes them comfortable. Negative result, excellent. 5 years to your next screening because the test is that reliable.
Wonderful. Great questions, folks. Thank you very much for sending them in, but hang tight because we have a stack more to get through, including why the age your mum was when she got breast cancer might matter and whether or not to get the genetic testing for the BRCA 1 and 2 genes. If you want to get a question answered by one of our experts or the fabulous Dr. Mariam here, here's how you can do that. You can hit up our DMs on Instagram, send me a message, I will chat to you personally, or you can go to the waiting room if you want to be anonymous. There's a link to that in our show notes. It's an online form. Or you can go old school and send us an email, well@mamamia.com.au. Okay, Mariam, you're up.
Let's do it.
Why does the age your female relatives get breast cancer matter? My doctor said because my mum got it when she was older, I didn't have to worry as much. What's the difference to if she'd had it younger?
So, yes, the age at which your female relatives, like your mum, were diagnosed with breast cancer, it does matter. If it's a first-degree relative, so that's your mum or your sister, developed breast cancer at a younger age, that will significantly increase your own lifetime risk more than if she was diagnosed later in life. And that's generally because earlier onset breast cancer is more likely to be tied to inherited causes, like those genetic causes. Also important is having multiple first-degree relatives with breast or ovarian cancer further increases your risk as well. Most women diagnosed with breast cancer actually don't have close family history. Only around 5 to 10% of cases are actually linked to that inherited gene mutation. So if you're hearing you don't have to worry about it too much because your mum was older, there is some truth to that, but it doesn't mean that that's zero risk. It's more about understanding how high or not your risk might be. When we're talking breast cancer risk, I just wanted to use this opportunity to talk about iPrevent. It's a tool that I use with a lot of my patients. It's free. It's Australian made. It's an online tool, takes about 30 minutes, and it gives you a personalized 10-year and lifetime breast cancer risk estimate. It aligns with the Cancer Australian guidelines and has been shown to help women and GPs make informed choices without ramping up any anxiety. At the end of the questionnaire, you'll get a score, and if you have any concerns with that score, you just take that printout back to your GP and have a conversation.
Next question is also for you, Dr. Mariam. This person has written in, I just had a biopsy done on a lump in my boob. I'm so scared, mostly at this stage, about getting chemotherapy. Can you tell me what I might be in for?
Look, I hear you. Going through a biopsy and waiting for results, it's anxiety-provoking. It can stir up a lot of emotions.
The unknown is probably the worst part, right?
And then especially when the word chemotherapy starts to come up. But first, let's take one step at a time, girl. We don't know if it's cancer yet. Big breaths. It also might be a good idea to talk to a support person or your GP. Let them know how you're feeling so you're not alone in this. But if chemotherapy is part of your treatment plan, it's usually given in cycles, periods of treatment followed by rest. This allows your body time to recover. Goal is to target and destroy cancer cells because chemotherapy affects all these rapidly dividing cancer cells, but it can also impact healthy cells. And that's what leads to the side effects that we commonly see. And that's the fatigue, the nausea, the hair loss, and changes in appetite. But it's really important that we explain that the side effects vary from person to person. Not everyone experiences all of them. And it's also noting that we've had so many advancements in breast cancer treatment, and we have so many medications that also treat a lot of the side effects that we see with chemotherapy. Remember, you're not alone in this. Your healthcare team is there to support you every step of the way. Waiting for those biopsy results can be very triggering for a lot of people. Please reach out, speak to someone, and make sure you've got adequate support around you.
And if it's interrupting your sleep, because that's often when our thoughts go a little bit haywire, go back and have a listen to our mindfulness meditation. There's a little meditation at the end, which actually helps me go to sleep at night.
It's amazing.
All right, these next few questions are being answered by Dr. Belinda Yeo. She's a medical oncologist who also works at the Olivia Newton-John Cancer Research Institute in Melbourne. We asked her about whether to get tested for the BRCA gene mutation or not.
The first question from our well community is this one. My mother had breast cancer at 44 and is the only person in our family to have had it. She is still with us after successful surgery and treatment for a ductal carcinoma. Back in the year 2000, when she was being treated, my sister and I opted not to get the BRCA gene test as there wasn't a strong family history, just mum, and the cost was a bit outrageous. She says, now I'm 48, I'm thinking about it and I'm very pragmatic and would just have a mastectomy if it came back positive. But I worry that by getting the test, it might affect my daughter's ability to get insurance coverage down the track if the government changes whether genetic testing can be taken into consideration. In your opinion, should she, with her circumstances, get the BRCA test?
Well, there's an easy answer to that and there's a much harder one. And the easy approach to that is, given your mum is alive and sounds like well, which is good, my first response to this is we test the patient who has had the breast cancer. If you can, we can't always, but we always start with the person who has had the breast cancer and test whether or not, in fact, they harbour the gene. And you're absolutely right. The gene testing was previously very expensive and it's come down and down. And I'm really pleased to say, actually, that at least for patients who are newly diagnosed, we can do funded testing. So there's not an out-of-pocket cost for patients who have had a breast cancer much, much more widely. So yes, you're absolutely right. If your mum was diagnosed many years ago without a family history, she wouldn't have been offered testing, but she potentially would be now. So I guess the first thing is whether or not mum is open to being tested. And I say that only because if we test the person with the cancer and there isn't the gene there, the likelihood of the gene being in family members who haven't had a breast cancer is no more than the population. So certainly you can go out and still self-fund predictive gene testing. So in patients who have not had cancer, I think if you're doing that, then you really want to go and have a chat with a genetics counsellor to understand what that information means. Everyone thinks about what a positive test would mean, and it sounds like you've thought about what that would mean for you. But there's lots of implications of having a negative test and having that reassurance. I think just in terms of your comment about the insurance, you're absolutely right. So both in Australia and New Zealand, and I think they're still really looking at the implications for genetic testing. My personal opinion is information is power. And for the patients that I see with breast cancer, I think having a gene test positive or negative is information that we can act on. So I think it's a really valuable thing to do, but it's got to be right for every patient. And some patients don't want to have that information.
Amazing. All right, our second question from our listeners is this one. She said, is any pain in my breast something that I should have checked out, and could it be cancer? I sometimes get random pangs in my boobs and they do get very sore when I get my period, but I haven't felt any lumps.
Yeah, so we all get random pains in our breasts. I think that's a lifelong experience, isn't it? What a joy. And our bodies change, of course, across the cycle, and even as we go through perimenopause, which can go for years. And then, of course, even in postmenopause, it changes if we start new medications. It changes if we change our body habitus, if we put on weight, if we exercise more. So there are so many things that can cause breast pain. And I'm a medical oncologist, so usually the breast pain that I see has been related to cancer. But that's because 95% of the breast pain that isn't breast cancer related, I never see. So I think it's about being sensible. If you're worried about something, if you can't explain it, and I often say that to people, if you've got something that you just can't explain, it's not that you had a trauma to the breast, or it's not cyclical and it comes on day 15 of your cycle every time, then that's worth going and speaking to a medical professional and having it checked out. And you won't need to meet a medical oncologist, but, go to, for example, your general practitioner. Is we make a decision based on, all right, well, what do we think it is? And if there is any specific concerns, then it's deciding, all right, what's the next step? Is there enough information here where we should go and perform some imaging? Is this worth monitoring? So it is very difficult, but a lot of the things that happen in our breast are not breast cancer. In fact, I would argue probably most of them aren't breast cancer, which is reassuring. But if you're worried about it, then absolutely go and talk to someone.
Thank you, Dr. Yeo. Okay, we're skipping from one expert to the next right now, because the next two questions are for colorectal surgeon Dr. Penelope de la Cavallery. She is a spokesperson too for Bowel Cancer Australia. We asked her about the accuracy of the at-home bowel cancer screening tests.
It's important that you don't do it when you can see blood, because if you see blood, of course, it's going to be positive. And again, you don't need the test if you see blood, right? It's important to read instructions. You have to do 3 tests. Try to do it from 3 different bowel openings rather than the same one, because that increases the chances of you having different samples. Send it off as soon as you put it in, basically, that day in the afternoon or the next day in the morning. Don't leave it under the sun, in the windowsill, in your car, that type of thing. It's very important that if you have any symptoms, you don't even bother doing the test. You just need a colonoscopy. So advocate for yourself. You know your body best. Make sure that your GP specialist is your regular specialist that you have already a relationship with, so that you can actually confide your symptoms and feel comfortable about talking to them. If you haven't got any symptoms and you do the test and it's negative, the likelihood of this missing a tumor is low.
Our next question from the Well community. What are some really obvious things I can avoid to lower my risk of getting bowel cancer if I don't have family history? All I know is to eat less red meat.
That's a fantastic question. And there's a lovely, lovely link on Bowel Cancer Australia about modifiable risks, where you have a list of things that you can do. And apart from the red meat, increasing your fiber to at least 30 grams per day or more, having a wholesome, whole foods, non-processed diet as much as possible, having some dairy of at least 400 grams a day, doing exercise 30 minutes a day, limiting your alcohol, not smoking. The 3 things that are most important is knowing your family history, decreases the chances of having bowel cancer, because then you will get that needed colonoscopy, doing your bowel cancer screening test from the age of 45, but you can request it from the age of 40 or whenever you are worried about a family history. And thirdly, to advocate for yourself. Age is just a number, okay? It's not a symptom, and we don't treat age. We treat the symptom and we diagnose from that. So advocate for yourself and just request it. And if you feel that you get dismissed, which sometimes can happen, unfortunately, you go and get a second opinion. There's plenty of GP specialists, and you can even ask for a referral and say, thank you so much, but I would still like to have a chat with a specialist.
What a legend. Thank you very much for helping us out today. But we're going back to you, Dr. Mariam. All right, Dr. Mariam, your next question from the well community is, my friend has bowel cancer and is freaking out that she'll end up with a bag if she has to have surgery. How often do you end up wearing one of those bags outside your body to collect poo? Just as a side note here, I just watched a video of Cass Burgell. She plays rugby for the US team, and she does that with her ileostomy bag attached to her. So it's not like you have to stay inside for the rest of your life once you get one on, right?
No.
But what are the chances that you'll end up with one if you do have surgery?
Bowel cancer surgery may involve a stoma, and that's a surgically created opening in the abdomen, and that's where waste will exit through this opening into the attached bag. It's completely natural to feel nervous or even grossed out by the idea of a stoma bag, but let me walk you through what actually happens. First up, not everyone who has surgery ends up with a stoma. When needed, it might be temporary, so that's typically used to give the bowel some time to rest and heal.
So it could be reversed.
Yeah, and it's usually reversed, and that is closed and reconnected in 3 to 12 months or so after the initial surgery. And in about 1 in 10 cases of rectal cancer, it might be a permanent bag. If her friend does require one, she shouldn't be alarmed. Having a stoma just means that the body's diversing waste through another opening. And a lot of people get really good, skilled team around them to help them manage it confidently.
I used to work with someone who used one actually, and it's amazing how she'd disappear for a minute or two and come back. She goes, I just had to empty. I was like, okay, cool.
You settle into a rhythm and it becomes part of your routine, and it's quite discreet under your clothing. I know it's overwhelming and scary, but just take one day at a time and we'll see how it goes.
Amazing. Okay, another one for you. This one is, I was recently diagnosed with rectal cancer. I'm super embarrassed to tell anyone. I'm not sure exactly what question I have for you, but I just wanted you to know that having butt cancer is really not talked about enough, and those of us who have it are feeling like we're in the dark.
Yeah, thanks for sharing that. It takes courage, and you absolutely don't need to feel embarrassed. Butt cancer isn't spoken about as often as it should be, and being diagnosed with rectal cancer can leave you feeling isolated and in the dark. It's real and it matters, so let's clear away some of that darkness. Talking about it, yes, I know it's unsexy, but we need to break down that stigma, and we need to start supporting people that are going through this. It's real people with real lives. And the truth is, early detection makes bowel cancer one of the most treatable cancers. And when we normalize these conversations, it opens the door for people to seek help early. A lot of people have so many rectal complaints and are just so embarrassed to seek care or see a doctor or speak to anyone about it. And sometimes it's just itchiness or it's skin changes or a little bit of bleeding here and there. And just because it's one of those taboo areas, we're like, oh, I'll just put up with it for a little bit longer. But it's that time that makes all the difference.
And the idea of going to your doctor and having to show your butt, it's intimidating.
I just want to reassure everyone, I see about 5 butts a day, and I have no recollection. As soon as you walk out the room,
You've forgotten about my butt?
I'm sorry. You know, your butt is forgotten. It is not that memorable.
Okay, that is good to know.
But for our lovely listener, support is out there even when you feel like you're on your own. Bowel Cancer Australia offers a free and confidential helpline. It's staffed by nurses, nutritionists and support workers. You can connect with them via phone, email or video. They also run peer-to-peer groups, and there's a podcast called The Bottom Line.
Amazing.
That's hosted by survivor Stephanie. Listening to stories like yours can be deeply comforting and empowering. Then there's the Cancer Council's number, 13 11 20. That's another invaluable resource. It's free Australian-wide helpline where you can speak to trained professionals who listen and link you into local peer support groups and services. Even chatting to your friendly GP might be a great place to start with just how you're feeling. You might feel invisible or stuck right now, but you're not alone. Services exist, and no one deserves to face this journey in silence. So open up, speak to someone, because support is out there, and it's really, really going to help you. There's actually that movie with Kate Hudson, I think it's called A Little Bit of Heaven. She gets diagnosed with rectal cancer. It's a really great movie, great watch, yeah.
Well, there you go. People are having conversations about it. Well, that's all the questions we have time for today. Thank you so much for reaching out. And as I mentioned before, there's a heap of ways that you can get your questions into us. Remember, as I mentioned, all this information is general. Take it to your own doctors. Get yourself a team of people around you who are going to help you with all of these things. And when it comes to cancer, I don't think you understand how many people will come out of the woodwork to help you out when that time happens. Next week, we're going to be doing something a little bit different because normally we would follow this up with a real life story of someone. But we thought it was time for a bit of motivation because sometimes talking about cancer can be a little heavy and can sometimes get a little bit dark. So we are going to lean into positivity and we're going to bring you the No Filter conversation with Mel Robbins on the only life lesson you need to know. Now, this is the woman who's turned her life advice into a global movement. Yep. If you have not seen the Let Them book, it is on like every bookstore shelf and every major department store. We're going to get positive. Tune in for some really inspirational content on how to change your approach to life. It is really good. And then we're going to be stepping up to the mirror after that because we're going to be looking at our skin. Anti-aging messages to injectables and fillers and how to deal with the fact that we were under the impression that once you stop being a teenager, pimples stopped happening.
Not true.
Did not happen for me, I will say. And then we're going to talk about things like eczema and psoriasis and rosacea and lots of different skin conditions that impact a lot of us. And then we will touch on skin cancer as well because as Australians, we are all too aware of how slip, slop, slap, seek and slide.
Shade.
Slide, sleek, slide. There's lots of S's in that message anyway. So that is coming up soon. So if you do have questions about your skin, make sure you get them in. Have a great day. We'll see you next Thursday.
Bye-bye.
Well is produced by me, Claire Murphy, and our senior producer, Sally Best, with audio production by Scott Stronach and video production by Julian Rosario, with social production by Ellie Moore.
Mamma Mia acknowledges the traditional owners of the land we have recorded this podcast on, the Gadigal people of the Eora Nation. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander cultures.